Thank you so much. Thank you for that introduction. And thank you all for being here today. It's so exciting to see a full room and to know that you all are here because you want to learn about how to advocate more for the Latino community. So really excited to have you present. All right, so today I'm going to be talking about Latino homelessness. I'm going to be talking about the increase that we've seen between 2020 and 2022. And I will first start off by just giving a general understanding of what we know with regards to housing precarity among the Latino community. So we know that Latinos experience very high levels of poverty. We also know that Latino households are more likely to double up and live in overcrowded housing, something that is not captured in homeless counts. We know from research that's been done that Latinos are also more likely to experience high rent burden. That means paying more than 30% of your income to rent. We also know that there's been work done showing that Latinos are also more likely to experience evictions compared to, say, the white American population. And then the last point I want to make is that we know that our Latino population has a large foreign-born, so about 45% in 2019 were identified as being foreign-born. And when we talk about foreign-born populations, we know that they tend to experience some unique challenges with regards to things like community integration, which includes like understanding how to navigate public benefits or just various systems within their host country. And then what do we know about Latino homelessness? So one of the things that I want to start off by saying is that there has not been much work done on Latino homelessness. That includes not much research done on Latino homelessness and not much policy action on Latino homelessness. Historically, what we've seen in research that's been done, we've seen folks talk about the Latino paradox. So this idea that there are lower rates of homelessness than one would expect given the population socioeconomic characteristics. For years, we've seen that Latino homelessness is much lower than we would anticipate given high level of poverty. So just to give you an example, in Los Angeles County back in, I'm going to say this was 2020, we saw Latino homelessness was at about 36%, whereas the county, we had a population about 49%. So a smaller proportion of Latinos experiencing homelessness as indicated in the point in time count. And that's important to note because a lot of people are not being captured in point in time counts. We also know from previous work that's been done that Latinos tend to rely very heavily on their social networks and that they have limited use of public services. And that includes limited connection to homeless services. And then lastly, as I mentioned, they tend to be systematically undercounted when we talk about homeless counts, point-in-time counts, because they exist outside of traditional homeless spaces. So that includes, if folks are not entering our shelter system, they're not going to be counted as sheltered homeless. If folks are doubled up, couch surfing, living in substandard conditions such as converted garages, they're not going to be counted in our point in time. If folks are living in abandoned buildings or hard to reach places such as riverbeds, they're not going to be captured in our point in time count. So based on numbers that came out earlier, they came out last year. Actually they came out earlier this year because we were slow in releasing numbers. We know that at the national level, Latino homelessness increased. So if we look at the numbers here, we see that Latino homelessness increased close to 8% at the national level. The non-Latino Hispanic population actually decreased by 8%. So increases at the national level. And then if we look at continuum of cares, so continuum of cares across the country, these are continuum of cares the COC helps provide homeless services to our local communities. If we look at the 10 largest COCs, this is based on the 2020 point in time count, we either see that Latino homelessness increased significantly or decreased a lot slower when we look at the general population. And then if we look at the largest COCs, we have, 2, 4, 6 that are located in California. So 6 of our largest COCs are located in California, and we're seeing significant increases in the population of Latinos experiencing homelessness. In Los Angeles County, which is where I come from, we see that there was about a 17% increase when we look at Latinos experiencing homelessness. This is very, very alarming, especially when you think about other populations actually saw a decrease. So again, not much work has been done around Latino homelessness, but what can we speculate, right? What happened between 2020 and 2022? We saw COVID-19. COVID-19 had significant impacts not only on people's health, but also in terms of economic impacts. The impacts were particularly stark when we think about the Latino community. So in terms of health impacts, we saw that risk of infection, hospitalization, and death was more likely to occur among the Latino community when we compare to their white counterparts. This is important because a loss of job, if you're not able to work, you can't pay your rent, right? And on that front, in 2020, so the height of the COVID-19 pandemic, we saw that Latinos had significantly high rates of unemployment. So about 18% compared to about 13% among whites. Additional numbers have also shown that Latinos are recovering a bit slower than other populations when it comes to economic recovery. And then we also know that many Latinos did not access some of the benefits that were coming down with COVID-19 relief. In the state of California, we saw only about 35% of applicants for rent relief programs were Latino, whereas Latinos make up about 57% of the renter population. So there are various reports where Latinos were not applying to and receiving rent relief in California. In addition, at the national level, we saw that Latinos were less likely to receive stimulus payments and to claim the child tax credit. So some of you have probably heard the child tax credit has been touted as helping relieve child poverty across the nation. And so I want to get into some of our potential policy solutions. And as I talk through them, I'm also going to talk about findings which are based on previous work that we've done in collaboration with LPPI to try to understand how are or are not the Latino community connecting to homeless services. And the other thing I want to say before I get into this is that there's really 2 big buckets here, right? So we have to think about the prevention bucket. What do we need to do in order to stop people from falling into homelessness? And then there's what do we do once people have fallen into homelessness? How do we help them rapidly get back into stable housing? And what I'll be talking about today is primarily a focus on our homeless service system, which is where I do a lot of my work. But there are a lot of things that we also need to think about when we talk about prevention. And that's things like, do we have affordable housing? Are we building enough housing nationwide? What does a living wage look like? How are we dealing with wage theft among undocumented and immigrant populations? Really improving our safety net and making sure that there are resources there to catch people before they fall. And so I'm happy to talk more about that too, if there's questions in Q&A. But in terms of some of our policy solutions when we think about the homeless service system, one of the things that we found and other work has also shown is that Latinos tend to be first-time homeless. So that means that they're not familiar with the homeless service system. If any one of you has ever had to seek resources or assist someone in seeking resources, you know that that's a difficult system to navigate. Not being familiar with homeless service system also means that you're less likely to know where to go if you need help. I love that Berenice brought up trusted institutions and the work that Altamed has been doing, because trusted institutions are key. And one of the things that we hear out in the field is that Latinos are more likely to self-identify as experiencing homelessness in trusted institutions, such as community health care centers, or they're talking to their medical doctors, such as churches, where they have a relationship with the parish and the folks that run these organizations. And so we really need to make sure that homeless services is partnering across the board with the institutions that are key in our communities. So we need to increase outreach and communication to the Latino community, making sure that our non-traditional homeless service providers know how to connect folks to resources and when to send them when they need help. The other thing that I'll say here is we need to make sure that we're communicating this information in Spanish, right? One of the things that I do a lot when I'm advocating, especially in my role as part of the Los Angeles Homeless Services Authority, I ask, do we have someone who speaks Spanish that can talk to Spanish media? And you'll be surprised how many times I hear no. Along those lines, we need to make sure that our homeless services are providing that are accessible both in terms of the language and also in terms of the cultural strategies for engagement. So we hear a lot from our homeless service providers that they don't have translation, or they might have things like telephonic translation, which we know is not great when we're talking about building relationships with folks. So we need to make sure that there's adequate funding to support language access. The other thing that we see that's very pertinent to the Latino population are restrictions around who can use federal housing resources, right? So non-citizen populations, undocumented populations do not have access to these resources. There is a lot of opportunity at the state and local level to use state and local dollars that are not restricted by federal requirements in order to serve populations that are hard to house. So all of you at the state level, please advocate for allocating funding to folks. There is very limited resources that they can access. Also, with federal policy beginning in 2010, there's a big focus around chronic homelessness. That has really shifted the way that we think about affordable housing funding to focus on singles. We know that Latinos tend to experience homelessness, or are more likely to experience homelessness as part of a family or as part of a multi-generational household. We are not building housing for families. So we need more funding going towards family affordable housing units. And then lastly, one of the things that we've heard a lot in the last couple of years has been extreme fear around immigration status, issues around public charge, everything that happened during the Trump administration, anti-immigrant sentiment. We heard folks disenrolling from healthcare that qualified for healthcare. We heard folks not being willing to enroll in other public safety nets that their U.S. citizen-born children might be able to access. And so we need to make sure that we're promoting partnerships between legal aid and homeless services. We see some partnerships specifically around eviction, housing advocacy, but we also need partnerships around legal aid for immigration services, because that's huge in helping people understand what they're able to access. And I know I'm running out of time, but just lastly, these are a couple of current bills that you all can support and will have important impacts on addressing homelessness within our communities. The first two are cash transfer programs, including cash transfer for age, blind, and disabled immigrants, so making sure that they're able to qualify for cash transfer, and then also SB 227, which is an unemployment program for workers that have been excluded, so non-citizen workers. The third one here is AB 1738, and this would help allow for Department of Motors and the DMV, Department of Motors and Vehicles, to actually go out into the community and help people get IDs, get the documentation that they need in order to access housing programs. You will be surprised how often we hear that that's a huge barrier for people to access housing. And then lastly, AB 1085, which is creating Medi-Cal housing support benefit. So that would make sure that some of the dollars coming through Medi-Cal and some of the reform under CalAIM is made available to help support homeless services, including things like temporary housing, move-in dollars, for instance. And so I think there's a lot of opportunity here between the intersection of healthcare and our homeless services. And it's been exciting to see that Medi-Cal has been expanded to undocumented populations, and to see the CalAIM effort to allow resources to be used for housing. So I will stop there. I try to get through everything.
So don't go far. We
Okay.
have 5 minutes. I have so many thoughts around this, honestly. I think that, there's been historic investments here in the state of California as it relates to homelessness, right? We also know that in the healthcare equation, only 20% of the services that are delivered can be delivered in the exam room that will contribute to somebody's health and wellness. 80% is out in the community, right? And so it's the exact right thing to do as we, look to Dr. Bustamante's presentation here around Medi-Cal expansion to expand Medi-Cal, but there's so much more, and so I often think about, we're in a deficit environment, so it's the name of the game is prioritization of what's at the table, right? And so I want to ask, in terms of the historic investments that have been made, where are those dollars? Who's tracking the dollars? Have they been effective? And what else needs to be done in terms of prioritizing funding in this legislative cycle?
Yeah, that's a great question, Berenice. I mean, it feels like there are never enough resources, right? There have been, I will say the last couple of years, the investments have been significant to address homelessness. But the crisis of homelessness is very large, right? And it's not only like the people that we see on the streets, right? It's like everyone who's at the cusp of falling into homelessness. And so even when we talk about the Latino population and the huge increase that we saw between 2020 and 2022, one of the things that I've been telling folks is like people were already living on the edge. People were already living on the edge where one paycheck, one job loss meant that 3 households that were sharing maybe a 2-bedroom apartment were falling into homelessness. I've heard stories of 40 people living in 3-bedroom homes that once, and that's because they're pulling resources in order to make it happen. I think prevention is really key, so we need to make sure that we're investing dollars in prevention to stop people from falling into homelessness. I think, one of the things that we've seen, especially in California now with our new mayor, has been a movement towards what's being called the Inside Safe initiative, which is really another iteration of Project Roomkey that we saw during the COVID-19 pandemic. So we know Project Roomkey was working really well, like people were coming indoors, but I think what we need to start paying attention to is how we're staffing these sites and making sure that healthcare is a close partnership of homeless services. So I think the more that we can kind of leverage some of the opportunities for funding and resources through healthcare and partnering that with homeless services, I think that's going to help make sure that people that often have very high needs, mental health needs, substance use, maybe physical disability, not everyone, right? But the population that tends to experience chronic homelessness, the harder to house, those folks need a lot of healthcare support. So I think a big pressure point, big opportunity is a linkage between healthcare and the homeless service system.
Absolutely, and then across the lifespan from, birth to earth, as they say, right? Because we always worry about, I had the privilege of serving on the master plan for aging, and we really focused a lot on, what about our aging, undocumented seniors that speak another language, for example, right? And for me, that was Latinos and Spanish speakers. And so it gets more and more dire. I can start seeing the overlap really quickly as we look at data that, Latinas in community college are caring for someone other than, themselves, as we look at the housing and homelessness data. And so the equation is super duper complex. So I'd like to open it up to see if folks have any questions or any thoughts or impressions on what was presented. Please go ahead, Jesus.
Thank you. Thank you so much for your work.
Yeah.
It's super important. As we were at the state level thinking about developing, and we're working on developing grant programs, what are some recommendations that you can provide to ensure that the funding does go to the right communities, does go to the right organizations? And then my second question is that there was a 18% decrease in New York for homelessness. Did you all have an idea of what were the interventions that really worked?
Oh, that's a great question.
That helped New York decrease its homeless population?
Yeah. Well, so on your first question regarding how do we get funding to go to where it needs to go, right? I think, so there's a couple of things that come to mind. One is we really need to think about building the capacity of local community-based organizations. So for example, in Los Angeles County, one of the things I hear a lot is in the communities that are predominantly Latino, we don't have a lot of homeless service providers that are serving our communities. I think the Southeast Los Angeles region, where Ultimate is heavily invested and has done a lot of advocacy work.
And was the epicenter of the pandemic for the nation
And
after New York.
And we've seen a huge increase in Latino homelessness. There are very few providers. And I have asked people many times, like, can I see how the need matches up to the resources? And like, no one can really give me that data, that information. But I suspect that the need is not matching up to the resources, in part because Latinos are not being fully counted and captured in our official homeless count numbers. So when you think about the point in time count, one of the ways that is used is for resource allocation. These communities have the highest numbers, we allocate resources to them. Even like from local to national, right? Local CLCs send their numbers up to HUD. HUD then does a funding appropriations. So one of the things that I've been trying to push for is thinking about alternative measures to how we understand the scale of the problem. So as I mentioned, we're not going to capture people that are experiencing homelessness and doubled up. We're not going to capture the 30 people to a 3-bedroom home. We're not going to capture the person living in a garage that maybe has no facilities, no area to cook, no indoor restroom. We're not going to capture those folks. So how can we use things like census data to estimate potential need, and then use that information to think about how we allocate resources? So that's one thing, alternative measures for scaling the problem. And then the other thing is making sure that we're providing grants for community-based organizations to build capacity. A lot of our small nonprofit providers in Latino communities don't have the capacity to serve a significant number of folks. So very few that I know of in Los Angeles County, very small in scale compared to other nonprofits. So making sure that there are resources to build capacity is critical. And then your other question was around New York. So New York is somewhat different from Los Angeles because New York has a right to shelter. So you don't see as many unsheltered populations. To be honest, I have not been in conversation with folks from New York, and I agree with you, there's probably important lessons to be learned there. But it is very different from our system because I'm most familiar with Los Angeles, but throughout Los Angeles, California, we do not have that right to shelter. So we're not moving people indoors the same way that New York is moving indoors. And one of the things that we know is that when people are indoors, they're a lot easier to connect to resources because we know where they are, we know how to locate them. The other thing might be just the demographic breakdown of the population. I suspect that we have more of a Puerto Rican population in New York that have access to resources, whereas in Los Angeles we might have more of a like immigrant mixed status type of households that may not have access.
I think that I just want to underscore the community support for community-based organizations and really concentrating resources there. I will share that as we're the largest community clinic system, but we are a safety net, right? So we've been through the pandemic, we've been serving the highest need communities. We're suffering from healthcare workforce challenges. We're suffering from challenges to recruit doctors that speak the language, that are culturally competent, that are, insert issue here, right? And so that's the system, right? And that's us. And so we think about, we always are having the conversations around the social determinants and the social drivers of healthcare. But then when we identify someone, because you're right, they tell our doctors all the time, but the level of frustration from our physicians is tangible. And when they talk to me about, Betty, we got to do something about this, right? Like something at the policy level, what can be done? Because it's hard to do that warm handoff when you're so overloaded, right? When you're seeing so many patients, when you're burnt out, and when the system itself doesn't have anywhere to send this patient, right? And then when you send that patient there, like you said, a lot of these are like first-time homeless, right? And so then they get there and you literally have to handhold them the whole way through. And then that's another level of resource as well, right? And so meeting our communities where they are is a deep commitment. But if we make that commitment, right, we invest in the communities that are powering the economy of California, that's the right investment to make. And so we need to prioritize Latinos in all equations across the board, right? Like you say, Sonia, every issue is a Latino issue. Please.
I'm sorry, I did have a question. So I was struck by the fact that I think you said that a lot of Latinos are not receiving social services or like How Works or those types of programs. And if that is the case, I'm just kind of curious about that because I know there have been some studies that show that folks who are on benefits, there's a link between potentially falling into homelessness. So that's like a great access point. But if it's not serving people now, I wonder if there's why you think that is the case, and if it's those same challenges around language, and if there are some things we can do in that case. And I just want to say, for a right to shelter, we have talked about doing a right to shelter in California, but it's very expensive.
It
we
is.
end up spending all our money on shelter and not on permanent housing.
Yeah.
So I just want to say that out loud because we have talked about it.
Yeah, no, you bring up some great points. With your first one, I don't have the numbers, but anecdotally, like I've heard a lot during during Trump administration, the whole conversation around public charge, people disenrolling from services. With homeless services, it's like if you look at the numbers of our homeless management information system, which tracks interactions with homeless services, you see like the level of engagement. I'm just going to make up numbers right now, but like level of engagement with Latinos, let's say 40% outreach, first touch, and you look at who enters the shelter, then you'll see it drops down to like 30% enters shelter, and then you see like who from shelter enters permanent housing, and it drops down to 20%. So at each different service point, it drops down. So we have there's a disconnect happening there. Your point on like the not enrolling in public benefits, I think it's so important, especially when we're talking about things like predictive algorithms that people are using more and more in order to target resource allocation. So that's one of the big problems I have with LA County using predictive algorithms, because there are a lot of folks that are gonna be missed out and we're not targeting. So I think those are great points. And then your other point was the right to shelter. Yes. I mean, it's well, I guess the only thing that I'll say there is like there's a lot of opinions on the right to shelter, right? Where folks are saying, why are we building shelters when we know that the solution is permanent housing? And then you have other folks saying, but we see people that are dying on the streets, how can we not give them shelter? So it's really like finding the between those two things. And to be honest, I don't know what the answer is, right? We know that people need something, and we know housing takes a long time to build. Yeah, so we need to be doing everything. But thank you so much, and there's reports from the National Alliance to End Homelessness that we worked on over there, and feel free to grab some.